Thank you, Dr. Ravi, for asking this question. Firstly, a very good evening to all my dear audience. If we talk of the breast cancer burden in India, it is increasing compared to maybe 20, 30 years back when breast cancer was not that common, or it was still common in the urban population. It was not that common in the rural population. But definitely nowadays, we see the breast cancer encroaching onto the rural population because the quality of life is improving, the living standards as well as the habits which are changing with time. So also the non-communicable diseases like obesity and all those, which sometimes pose a risk factor for breast cancer, they are also increasing in the rural population. So if we look at the most recent data of breast cancer incidence, so almost 26 women out of 100,000 will have breast cancer in a year, and out of which 12 patients, so out of 26, approximately 12 patients will have a death or mortality because of the disease. So that is if we go by the figures. And well, there are stratifications based on the cities, based on the larger cities, based on the smaller cities, but definitely breast cancer presently is the most common cancer in India for women. And even if you take all cancers together, it ranks within the top three cancers in India. Uh, Dr. Ravi, you're muted.
I just wonder how is the situation different from the other countries here? Because I think is it a similar situation in the Western
Yeah,
world or other world, or it's a we have the same picture here? Because you mentioned that about
right.
26, about 100,000, and about 12 deaths. I think what is the kind of the incident rate, rather for that matter, the death mortality rate from that? I think more
Mhm.
specifically.
Well, since the treatment of breast cancer has significantly improved over the last couple of years, with more and more targeted therapies, better surgical procedures, more precision-based radiotherapy, so the mortality and also the people's awareness about breast cancer has improved. There were days when we used to see a lot of very advanced breast cancers patients presenting with a large tumor, which they have been harboring for quite a significant amount of time. But nowadays, we do get to see very small tumors, especially those who are well aware of the breast cancer. They usually come at a very early stage. So that way, the mortality part has definitely reduced compared to what it was previously. And if we talk of the comparison with the other countries, well, definitely Europe, US, all these developed countries, they definitely have a higher incidence of breast cancer compared to India as of now. Uh, but definitely, I'm sure with better strategies, the mortality of India will go down further. And if you look at the incidence and mortality of India versus other countries, well, quite unfortunately, we still have a significant chunk of our patients dying because they present at a more later stage compared to those in the Western population, because they have a very well structured screening program in the developed countries, which makes the patients come at an early stage to the physician and get treated rather than coming with a metastatic disease. So, if you look at there have been multiple studies, both mostly in the United States and other countries, which have looked at the role of screening in breast cancer, and some of the studies have come up with results that tell us that probably screening helps. And if you look at the most commonly used guidelines, so for women who are more than 40 years of age and who have a normal risk of developing breast cancer, I'll come to what is a normal risk and an increased risk. So, somebody who is more than 40 years of age, she should undergo a yearly clinical breast examination by a qualified and trained medical personnel, and after 40, and a mammography is recommended once a year. Now, the screening mammography does not help much in women around 40 years of age, because the density of the breast in such young women is much more, and smaller tumors can be missed. But after 40 to 45 years, the glandular structure of the breast and the fatty tissue changes in their composition, and mammography becomes more sensitive. And it can be done once a year, but depending on the breast density, it can be done once in 2 years as well. However, it is always recommended that one should do a mammography after consulting a doctor. So this is for women who are more than 40 years, normal risk. Now coming to women who are 25 to 40 years, this age group does not require mammography, because as I told that this is a younger population and the breast density is more, so mammography is not very sensitive. But definitely a woman of this age should undergo clinical breast examination every 2 to 3 years by a doctor. Now, there is a population of women who are at an increased risk of developing breast cancer. What increased risk means? Somebody who has a positive family history of multiple breast cancers in the family. And obviously, it has to be a first degree relative or a close one, and somebody who has got a well-known genetic abnormality, like for example BRCA1 BRCA2 gene. Sometimes some families know that they have this genetic abnormality, which is detected by a blood test when we do it for some patient who has suffered breast cancer, and somebody who has received radiation therapy to the chest wall for any cause. So these three are the situations where the patient has a higher chance of developing breast cancer. And in those situations, it is preferable that they do a mammography from the age of 25 years, although the sensitivity is low. But definitely by 35 years, they should be doing an annual mammography to just keep a watch on the breast. And sometimes, if mammography does not help, because some patients have large breasts, they have very dense breasts, sometimes the MRI of the breast is also useful. But all these recommendations are to be verified by a physician.